Hello, I'm Susan Hajkowski. I'm a psychodynamic psychotherapist and have worked for many years in psychiatry and psychotherapy services in the UK National Health Service. I deliver specialist practice in ISTDP and I teach, train and research in this approach.
Hello, my name is Stephen Buller. I too, like Susan, originally trained as a psychoanalytic, psychodynamic psychotherapist, also training and practicing in ISTDP. For much of my career, I have worked as a specialist psychotherapist in the NHS in roles which have encompassed clinical practice, teaching and research.
We are very pleased to be invited by the Polish Institute of ISTDP to present a two-day conference in Poland in March 2024.
One of our special interests is the application of ISTDP with more difficult to treat patient populations. Through our practice and research, we have developed techniques to apply ISTDP effectively with these patients. This includes techniques for working with somatic presentations where medical routes have offered limited benefit or relief from physical pain and emotional distress.
In this two-day conference, we will explore psychological and emotional difficulties in complex disorders which often manifest in somatic representations and physical pain. We will consider psychological mechanisms and concepts underpinning somatization, drawing on theoretical and technical understandings from psychoanalysis, ego psychology and object relations theory. Importantly, we will examine how current developments in ISTDP have therapeutic potential to identify and intervene in somatization. We will directly observe and explore working with ISTDP through video-based presentations of clinical work.
We will illustrate and discuss the use of an intervention-response sequence, which is essential to the practice of ISTDP. The sequence involves making precise, moment-by-moment evaluations of ego capacity, psychodiagnosis and formulation. These moment-by-moment evaluations are based on detailed observations of the patient and of phenomenology that can be observed. These evaluations guide the selection of interventions and how interventions are applied. The patient's response to our interventions in turn guides a formulation for our next interventions. We aim to closely engage with participants attending the conference in discussing how the sequence is applied, the therapist's intentionality, and how observations are used in making evaluations.
During the 2 days, we will include short case video examples as well as longer case presentations that illustrate the whole systems approach that we take to ISTDP. We will consider how the ISTDP model is formulated and applied to achieve permanent intrapsychic change and relief from debilitating physical conditions. We invite you to join us at the Medical University in Gdańsk and look forward to sharing our approach when we see you there.
Thank you.